Hi, this is Dr. Pujitha, consultant obstetrician and gynecologist. Today we are here to discuss an unique case we have dealt recently.
I'm Dr. Soumya. I'm a senior consultant radiologist working in Star Hospital's financial district.
So today we both are here to discuss about a rarest case what we have experienced recently in the financial district branch. So this is a patient came with an acute abdominal pain which was extending up to like 6th month of pregnancy. So it is nothing but 20 centimeters of fibroid. So I know what exactly it was happening. So I expected to be an ovarian torsion rather than the fibroid. But after diagnosing, after sending it to the radiologist, so we have Dr. Soumya with us to the radiologist. I think she is the right person to say, after sending it to her, what were her findings?
The girl came with a severe pain abdomen. We did an ultrasound first. Ultrasound showed a huge mass occupying the entire abdomen. It was so huge that it was extending up to the epigastric region and most of the organs were obscured by this mass. The patient was in severe pain. So because of that, I suggested a CT abdomen with contrast study. CT showed a huge mass extending up to the epigastric region. It was occupying the whole of the abdomen. And this is a surgical emergency. And this is my first case here. In my decade of practice, this is the first case that I have seen.
So immediately, actually, this case is an emergency. Gynecological surgery has to be done. There is no option for us because we have to detort it immediately. So we have planned this surgery in emergency. So intraoperatively, I could clearly see there is a 3 loops of torsion of the complete uterus along with the huge fibroid of 20 centimeters, which is filling complete tummy, that is abdomen. So after seeing this, so I have removed the fibroid. This was planned to remove only fibroid. She is 41 years old female, but now unfortunately she came with a complete torsion with loss of blood flow as confirmed with Dr. Soumya. 3 loops were torted. We usually say 3 times of 180 degrees, which is very severe grade, which is the rarest, which we have never seen in my decade practice also. So this kind of things are very rare. So first, I removed the fibroid. I have detorted it. I mean, this detwisting was done. Even after detwisting, we could not see the blood flow clearly. So with this is an indirect sign. Simply, if anywhere, any organ, the blood supply was gone, it is almost a dead tissue. So we have to remove it. So we have proceeded with laparoscopically, we have proceeded with an hysterectomy, that is total laparoscopic hysterectomy, along with this huge fibroid. You definitely will have a question, how could you remove such a big fibroid? So we have removed the fibroid with a machine called modulator. It just drills. You can see in the pictures where we are going to display. So that was like complete drilled out pieces can be seen here. So we can nicely drill it out. Of course, it will take long time. But successfully, we could remove complete uterus along with the huge fibroid laparoscopically with only 4 holes. They are hardly 5 holes. It's less than half centimeter. So this was a real success story from our side. Of course, I should thank everybody, including our anesthesia team, our OT technicians. See, maybe this is an opportunity for me to tell you, like there are other conditions where we have to be little alert. Why instead of this lady, instead of going for only removal of huge fibroid, she has to land it up with torsion. I mean, she has to land it up with hysterectomy. So this is called torsion. So it can occur to the other organs also, like ovarian cyst, like fallopian tubes. I have seen fallopian tubes which were torted. You can see in the pictures. There are 6 loops which were torted only with hydrosalpinx. That is called tubal enlargements. And sometimes we have seen this kind of 4 loops, 5 loops of torsion with ovarian cyst also. So maybe Dr. Soumya is the right person to tell us. So what kind of diagnosis we have to do when any patient with any ovarian cyst comes to us with very severe acute pain? I request Dr. Soumya to say what all the findings they usually say and what are the best modes of diagnosis to do it.
Usually ultrasound is the first investigation that we do. On ultrasound, you can see if usually ovary it tossed along with a cyst or any mass. Masses like teratomas or dermoid cysts can also undergo torsion along with the ovary, or a simple ovarian cyst can also get tossed along with the ovary. Female, when they come with pain abdomen, not only just the ovarian and tubal pathologies, we should also rule out other causes for pain abdomen, like renal colic, like ureteric calculi can also give a similar pain. Similarly, appendicitis, diverticulitis. So all these needs to be ruled out. And ultrasound is a good investigation of choice, first investigation of choice. If not, we can proceed with an MRI study of the pelvis. And if for huge lesions like fibroids and all, CT is a better option.
So this case, we also had in one experience with a beautiful case. She herself is a doctor. She was pregnant. So typically, Dr. Soumya, she was not believing, or sometimes because there might be a partial torsion, sometimes it will get detwisted, again it will get twisted. So we were not leaving that patient. We thought like, no, we have to be a little proactive. For that case, I think we have gone for MRI because CT can't be done in pregnancy. So there was a torsion typically, and we have done a surgery on her laparoscopically with 3 holes. We have completely detwisted it, removed the cyst, and preserved the all organs along with the pregnancy, which was nicely progressed till term, and we delivered successfully. As Dr. Soumya told, she told it's a partial and total torsions. Total torsion is very important for us because total torsions, sometimes it completely becomes necrosed. And like this female, what we have operated, we have to remove the organ. Tubes are important before pregnancy. Ovaries are important for every female. We should not lose the organ rather than preserving it. So this kind of things are very important for all the patients. So let us be a little proactive to prevent any complications. And let us be proactive to preserve our own organs. So thank you so much for your patience listening. Thank you.